So we're going to continue talking about thiazides and related agents. So thiazides are the most widely used diuretics, and they are sulfonamide derivatives. Okay, they are sulfonamide derivatives. So basically, this is a general sulfur drug molecular structure. So we can see here that there's similarity between this and sulfadiazine, sulfamethazine, sulfamethoxazole, okay, the ones that we have studied in the antibiotics section. So again, so we have chlorothiazide, okay, flumethiazide, benzyl hydrochlorothiazide, okay, hydrochlorothiazide, and then we have the one that diuretics called, okay, furosemide, bumetanide. So these are some of the structures. So thiazides are, all of them affect the distal convoluted tubule. Of course, it does not act only on the distal convoluted tubule, but all of the thiazides will act on the distal convoluted tubule. And they all have an equal maximum diuretic effect. Okay, and even though they have differing potency, okay, differing potency just means that you have to adjust the dose, so it doesn't really matter, the potency doesn't really matter. Okay, they are also known as the low ceiling diuretics, because when you increase the dose, even if you increase the dose more than the normal therapeutic level, it does not promote extra diuretic response. Okay, so because it has a ceiling there, it has a plateau. Okay, so thiazides, so chlorothiazide, its properties are representative of the thiazide group. Even though hydrochlorothiazide is more potent, okay, so it just means that you need a lower dose of hydrochlorothiazide. Nothing, no big deal there. And then we have chlorothalidone, indapamide, and metolazone, which are regarded as thiazide-like diuretics. Okay, they are not truly thiazides, but because they contain sulfonamide residue in their chemical structures, so because of their chemical structures, they are regarded as thiazide-like. Okay, so for example, this is indapamide. Okay, forget the brand name. There are so many brands out there, probably, okay, for every single drug. So just take note of the drug name, the active compound, which is indapamide. So here we have examples of some of the thiazides. This is a combination. Hyzar is a combination of hydrochlorothiazide with another drug, also the same one but different dosage. Okay, hydrochlorothiazide with losartan. Again, another brand. Okay, hydrochlorothiazide with another drug, okay, used to treat hypertension. And then we have hydrochlorothiazide on its own. Okay, if you want, you can check out this news, quite interesting news. Okay, just for those who want to hyper study or over study this subject. So the mechanism of action. So the thiazide and the thiazide-like diuretics, they act mainly in the cortical region. In the cortical region, say, remember, it's cortex and then medulla. The cortical region of the ascending loop of Henle, and then the distal convoluted tubule. Okay, they act to decrease the reabsorption of sodium. Okay, so they block the sodium chloride co-transporter on the luminal membrane of the tubule. You can forget the luminal membrane of the tubule, just remember that they somehow decrease the reabsorption of sodium by blocking sodium chloride co-transporter. Okay, that's all you need to remember for pharmacological purposes. Okay, so they have less effect in the proximal convoluted tubule. Okay, and this leads to an increase in the concentration of sodium and also chloride in the tubular fluid. Okay, because we know that if you block the ones in the PCT, Okay, so you're going to have less sodium and chloride in the tubular fluid. Okay. Okay, since that the place of action of the thiazide derivatives is on the luminal membrane, okay, so these drugs must be secreted into the tubular lumen to be effective. So how does thiazide diuretics lose its efficacy? So among others, when you have you have reduced renal function, and also when you have a concomitant use, when you concurrently use NSAIDs, non-steroidal anti-inflammatory drugs like ibuprofen, mefenamic acid, etc. So this will cause the thiazides to lose its efficacy. It's going to become less effective. Okay, so NSAIDs, how does it affect the efficacy or the effectiveness of thiazide? Is that it blocks production of renal prostaglandins. Okay, blocks production of renal prostaglandins, and this reduces the blood flow to the kidney. Okay, reduce the blood flow to the kidney, and that will reduce the efficacy of thiazides. So again, a little bit of recap on the anatomy. Okay, so actions. So A, number one, it causes increased excretion of sodium and chloride. Okay, thiazides cause increased excretion of sodium and chloride. So thiazides and the thiazide-like diuretics will cause increased excretion of sodium and chloride, and this may lead to an excretion of a very hyperosmolar urine. Okay, you have a very concentrated urine, and this is an effect which is not likely to be seen in other diuretic classes. Okay, so you don't really see this kind of hyperosmolar urine when you use the loop diuretics and the CAI diuretics. And the action of thiazide, the diuretic action, is not affected by the acid-base status of the body, and also hydrochlorothiazide does not change the acid-base status of the blood. Okay, so that's number one, increased excretion of sodium and chloride. Secondly, it causes a loss of potassium. Okay, thiazides causes loss of potassium. Okay, loss of potassium. So if you want to remember this, you might want to imagine bananas. Okay, bananas coming out of your urethra. Okay, coming out of your urine. There's lots and lots of bananas in your urine. So, and you know that bananas contain potassium. Okay, so that thiazides cause loss of potassium. So as thiazides increase sodium in the filtrate, reaching at the distal tubule, more potassium is also exchanged for sodium. Okay, because we have more sodium in the filtrate at the distal tubule. Okay, so when you have that, so you have more sodium to be exchanged to be with potassium. Okay, so potassium will be going in, okay, in the urine, okay, in the filtrate, okay, whereas sodium will be reabsorbed. Okay, sodium will be reabsorbed, and then potassium will be lost. Okay, it will come out in the urine. Okay, so chronic use of the drug will cause continual loss of potassium. Hence, that's why we need to measure serum potassium from time to time, especially during the beginning when we commence the thiazides. Okay, when we start a patient with thiazides, you want to monitor more the potassium levels so that you can monitor for hypokalemia. Thirdly, it causes a loss of magnesium. Okay, thiazides cause loss of magnesium, and in chronic use, you might, especially in the aged population, the elderly, you might need to supplement the loss of magnesium, even though the mechanism for magnesiuria, the magnesium in your urine, is not well understood. Number 4, it decreases urinary calcium excretion. Okay, thiazides reduce urinary calcium excretion, and so thiazide and thiazide-like diuretics reduces the calcium content of urine by supporting the reabsorption of calcium in the distal convoluted tubule. Okay, and this area is where the parathyroid hormone regulates or controls reabsorption. So this is an effect that is different from the effects with loop diuretics. Okay, because we know that loop diuretics increase the calcium concentration in the urine. Okay, so this one, it reduces the calcium content. Okay, so thiazides is pro keeping calcium. Okay, so it preserves, it maintains the bone mineral density at the hip and spine. Okay, at the hip and also the spine, and this may reduce the risk of fractures. So hopefully you can reduce the risk of fractures with thiazides. So the fifth thing that thiazides do is that it reduces peripheral vascular resistance. Okay, so this will lead to reduction in the blood pressure, because we know that the blood pressure equals to cardiac output times total peripheral resistance. So when you reduce the total peripheral resistance, that will cause a reduction in the blood pressure. Okay. Uses. Okay, what are the uses for thiazides? Number one is in hypertension. So it's one of the main drugs that is used to treat hypertension, and they are effective to reduce blood pressure in patients with mild to moderate essential hypertension. Okay, so in most cases, you can reduce the blood pressure if they are having just mild to moderate essential hypertension. Okay, so essential means primary, so the cause of hypertension is unknown. It's not due to a secondary cause. So next is blood pressure can be maintained with a daily dose of thiazide. Okay, so it causes a lower peripheral resistance without causing a major diuretic effect. So that's a good thing about thiazides. And so while some patients can be continued for years on thiazides alone, many will require extra medication to control the blood pressure. Okay, sometimes we need to add the adrenergic blockers, whether alpha or beta blockers, the ACE inhibitors, angiotensin converting enzyme inhibitors, okay, like captopril, enalapril, all that, or the angiotensin receptor blockers. So the anti-hypertensive actions of ACE inhibitors are enhanced. Okay, so it becomes better at its antihypertensive actions when given together with the thiazides. Okay, so this is quite an obvious thing, nothing to be surprised of. So second use is heart failure. So we know that the loop diuretics are the diuretics of choice in reducing the extracellular volume in heart failure. So it's not the first choice. Okay, thiazide is not the first choice in heart failure. However, we might add thiazides if additional diuresis is required. So when given together, if you want to give together, so the thiazides with loop, if you want to give it together, then thiazides should be given 30 minutes before the loop diuretics, because so that thiazides can reach the place of action and also produce its effect. Third effect is hypercalciuria. So it can be useful in treating idiopathic hypercalciuria, as the thiazides block the urinary calcium excretion. So this is it's particularly valuable, okay, beneficial for patients with calcium oxalate stones, okay, in the urinary tract. Fourthly, diabetes insipidus. So treatment with thiazide may produce a hyperosmolar urine, okay, so which is helpful in patients with diabetes insipidus, and it can replace antidiuretic hormone in the treatment of nephrogenic diabetes insipidus. So we'll continue in the next video. Thank you.